Everyone, we're just going to take one moment for folks to still get into the room. Thank you for joining us. All right, I think everyone's been in. We are recording this, so if anyone is unable to attend today, they can watch this online starting tomorrow to be brought up to date. But really just wanted to take this opportunity to go through what the Virtual Advocacy Day will look like next Wednesday for the Hep B United Virtual Advocacy Day. We're going to hear from three of us today. Myself, who is Frank Hood, the director of Hep B United, and I also do policy work with the Hepatitis B Foundation. Michaela Jackson, the program director for prevention policy with the foundation, and Ray Aracho, who's our program director for advocacy and engagement at the foundation. Today's webinar is fairly straightforward in the fact that we're just walking through what a typical advocacy visit is like, as well as some of our specific talking points. We will have a short role play at the end, so you have a bit of an example of what one of these meetings looks like in actuality, and there will be time for questions. And like I said, we are recording this, so those who don't make it, who aren't able to attend today, can watch it between now and next week. Sorry, just looking over here. And we will end the recording after the role play, so your questions aren't going to be part of that, because we hope that this will be usable for more than just this coming Hill Day, but for ones in the future, since some of the normal tips and tricks are relevant beyond just this particular advocacy day. So to kick it off, what are Hill visits? We run around and we say this term Hill visits, and it seems like it's something big or different, and really it's just another name for meeting with a congressperson's staff. They're called Hill visits because where the Capitol building is, it's on a hill, and that hill and the area around it has now been termed Capitol Hill. And so when you go and have a meeting with a policymaker staff, you have to go to the Hill. And so it's over the years has become taking a visit to the Hill, and so they just get dropped a Hill visit. Yes, it's an actual hill. If you think this is a strange naming convention for something, it is no more strange than the term lobbyist, which is, none of us are lobbyists, but there's a hotel in the city just down Pennsylvania Avenue, just past the White House, that used to be a frequent haunt of a president in the 1800s, maybe early 1900s. And the people who knew that the president frequented this location would kind of just stake out in the lobby between the front door and the bar or hotel area. And eventually the president was like, "Oh, you're just a bunch of dang lobbyists," and the term stuck for someone who advocates on behalf of like corporations or things like that. So just one of those weird DC things. That's what happens with it in person, though. Here, virtually, Hill visits look like just any other Zoom meeting. There aren't any slides or anything like that. It really is a conversational, friendly group of faces on the screen. Which is just to say that as you prepare to walk into these visits, it's really no different than kind of meeting anyone else in your line of work for the first time. Folks are curious, be curious, and in general, everyone's happy to be there. So moving on, I'll turn it over to my colleague, Michaela.
Excellent. So hi everyone, I'm Michaela Jackson, and so I'll talk a little bit about who's going to be at the Hill visits and why we do them. So next slide, please. So essentially, there's typically a minimum of like 3 people that will be there. So every group might look a little bit different just based upon who is able to attend that day. But the main person who's typically there is a congressional staff member. And oftentimes this is a mid-level staff person, and typically they have a focus on policy in health or funding. And other times this can be a fellow who has specialized training. So as Raya's going to talk about a little bit later, which staff person is there can kind of influence how you might start off the her visit. So that might be something that's important to pay attention to. And then for our purposes, you will have a couple other group members here with the visits. So obviously the Hep B United members, so you guys will be there in attendance. We have some Just Be storytellers who will be able to attend and share their experiences, which is also really powerful. Hep B Foundation staff will be present, and we will be the ones who will help guide you, ease your way into everything. If there's any questions that somebody may not get comfortable answering, Hep B Foundation staff is happy to. Sometimes there'll be other hepatitis and infectious disease advocates involved as well. And there are also so members of the group who might be designated hill guides to ensure things go smoothly. And that can be either on a volunteer basis or Hep B Foundation staff member. So there's always somebody in the group available to kind of make sure that everything operates as smoothly as possible. Next slide. So now we can talk a little bit about why we do the hill visits. Next slide. Essentially, hill visits are a really great opportunity for the communities who are really engaged and on the ground, seeing what's going on in this hepatitis B space, to come forward and share their experiences, to share their thoughts about what's needed in order to support these communities. So we essentially do them because we deserve and demand action on all of these fronts. We're talking to legislators because they're the ones who have the power to do something about it. They're the ones who are able to provide more resources to the community groups. They're the ones who can influence legislation that will help us. So we really need to make sure that we get our points across to the staff members and in turn the legislators. And so by doing these hill visits, whether it's virtual or in person, we're really making sure that everybody is aware of our issues and why it's so important that we address them. I think it's very important to highlight that there's so many other groups who are doing hill visits as well, right? So everybody has something to say. So we really need to be as persuasive as possible and make sure that we're getting our point across so that they're more likely to do something about it. Doing these hill visits is a really great way to strengthen and build the relationships with policymakers so that when we come back year after year and ask for something, we already have a really great foundation that we're starting from, and we have a really great connection so that they might be more likely to listen to us in the future, especially if something comes up later on that we need help with on an issue. But just making sure that we have those connections is really, really essential. And so after that, I can actually turn it over to my colleague Raya to talk a little bit more about hill visits.
Thank you. Yeah, so this next section, we're just going to kind of walk through what the meeting will look like. So on the next slide, we have an outline. Just to start off, since we're just as a reminder, these are going to be all virtual meetings. So we know that based off of previous meetings and just scheduling that we have 30 minutes at most with the staffers. So 30 minutes would be the high end, but don't be alarmed if they seem to be in a rush and you may only get 15 minutes, 20 minutes. But usually we've seen with virtual meetings that since they don't have to go and meet people physically, that they should be able to sit there for the full 30 minutes. So you should budget for maybe around speaking for around 15, 20 minutes, just so there's enough time for conversation and discussion for that last 10 minutes as well. I would also say, once you get your schedule and the Zoom information, have that on your calendar, but maybe try to join 5 minutes early with the rest of your group in case there's questions or things you want to discuss before the staffer hops onto the call. But once the meeting time, once you actually get started, of course, you want to start with introductions. And we typically have somebody in the group just, say hello and start things off, and have the advocates introduce themselves first. You can just do names, organizations, and where you are located. So that is particularly important to note, so that they recognize that they are with actual constituents. So if you live in, mention which city you live in, or which city, county that you do most of your work, if you're representing an organization that does community work, so that they can make the connection of where you're from specifically. And then also, because we are bringing together people from different organizations, it's important for somebody to note that you're all members of Hep B United, the National Coalition, and that we're here together today for a Hep B United Virtual Advocacy Day, all representing this coalition. And then you can pass it over to the staff person to introduce themselves as well. And as Michaela mentioned, try to take note of if they say something besides that they're a health legislative assistant, if they say that they're a fellow with, they might provide more of their background. Our team has met with people that are MDs, and they've been assigned to this particular office to be a medical fellow, or to be something, maybe their background is in public health already. Or maybe it's something completely different. So you can get a sense of how familiar they might be with the issues that we're about to talk about based off of how they introduce themselves and how long they've been in the office. Maybe they're very new. Sometimes they say that right up front, like they just took over the health portfolio. And if you hear that, then you can spend a little bit more time on introducing hepatitis B. So that is the next bullet. You can just flat out ask them, are you familiar with hepatitis B? Do you want us to give you a quick 101? And you'll see that we have prepared a fact sheet or a leave behind that you can take a look at before, with some of those talking points that you can use just to give the quick rundown of hepatitis B, the virus, and who it impacts, how it's transmitted, and that sort of thing. And yeah, you don't want to spend too much time on it if it sounds like the person has said that they don't need it. But if they do invite you to, then go ahead and go through the basics. You can talk also about, it's always a good reminder for anybody, especially since sometimes, it may have been a while since they've met with us, just to go ahead and reiterate what the numbers are over for hepatitis B. So you can give the national statistics in terms of cases and where we might see bigger numbers or higher transmission rates, especially if that is relevant to the specific state or district that you are meeting with at that time. And then you can tie in any relevant connections from the group to the work that's being described. So if you are representing a community organization that does screenings or that does awareness events or that sort of thing, you can mention, you can make as many tie-ins as you can to the work that's being done in their district or state. And then, so that should take, I don't know, maybe up to 10 minutes, 10 minutes of the beginning of the meeting. And then you can go through and outline what we're actually asking their support for. And we'll go over those, Frank will go over those in more detail. And then once you've covered all of that, you can leave it open for questions from them. And hopefully they have, they might actually stop you when you're talking for questions, and that's okay too. You can just kind of have to go with the flow a little bit, and people can jump in. If you're the one speaking and they ask you a question and you can't answer it, you can either say that you'll take note of that question and somebody will get back to you, or you can see if somebody else in the group can go ahead and answer the question. Yeah, so let's see. So then you'll wrap up and thank them for their time, and just let them know that a Hepatitis B Foundation or Hep B United representative will definitely be able to follow up with them for any questions. And you can also offer that as well for your organization to be a resource if they ever want to know more or have questions about what's going on. Sometimes staff members and members themselves will want to schedule something where they could learn more about what your organization is doing. So you could try to stay in touch with them and get in touch with their in-district staff to talk about meetings or site visits that you can do locally. So before I hand it over to Frank, I just also want to go over on the next slide how we can go about telling our story and what it means to be in these meetings and be able to just share your experience. So this is fairly quick, but we just know that it's so important to reiterate that although we are going to go over a lot of specific kind of stats and talking points, and we want to have to make sure that we bring up and ask at the end of the meeting, those are all things that, you know, that are also written down on a fact sheet and that we can follow up with if there's any need for clarification. But what we can't recreate is having you guys there in the meetings who are constituents and who are people with lived experience, who are either, you know, the people living with hepatitis B or those that are working every day, doing work every day in the community with people living with hepatitis B. And so this is really, really important face-to-face time, Zoom face-to-face, but, you know, face-to-face time with staffers who, you know, it's their job to hear directly from their constituents about the types of issues and things that are impacting them and the changes that they want to see in their communities. So all you have to do is, you know, share your experience and be yourself. Don't feel like you have to study and know every statistic or be a hepatitis B expert in terms of the medical and scientific or epidemiology or any of that. It's just what you are bringing to the table is that you have real life experience with this disease that impacts people in real ways every day. And people, you know, there's so little awareness around it and people don't know how big of an impact it is. So it's really important to just, you know, share openly about that. And I think that staffers are interested in knowing that actual human impact of these things that they're then expected to go around and make decisions about in terms of funding and policy. So just think about, you know, what you're comfortable sharing. You don't have to obviously go into that much detail or share anything that you're not comfortable with. And, you know, we do have limited time, but, you know, you're able to use this time to just speak from the heart and talk about why these issues and the things we're asking for are so important to you or the communities that you represent and work for. So with that, I'll pass it over to Frank for the next part.
Thank you, Rhea. So our next section is what we ask for. So this is our specific talking points. And again, I want to reiterate what Rhea just said around these asks are written down. In fact, I'm going to share my screen here in a moment to show you the handout that we're going to virtually leave for them to refer back to after, you know, for them to be able to refer back to after our meeting. In case they need to be like, oh, what was that specific number they said? Or like, what was I remember they had an ask, but I don't remember all the specifics. Like, this is what the document I'll show you is for. That document though will also exist for if for some reason you have a specific piece in it that you want to dive in on talking points, you're able to. But for the most part, the folks that kind of are already doing the talking points as part of advocacy will be the one who do the ask in your meeting. Why I wanted to really go through this section though about what our asks are. One, when you all to know what it is you're advocating for, because you know, if it's something you're not comfortable with, you should know that now and before you're in the room. Additionally, just because these are the talking points and that others might be covering it, by you being familiar with the talking points, you know kind of where your personal story intersects with what it is we're asking for and how it is we're asking for it. And what I mean by that is, you know, if you have a particularly poignant story around a screening experience or getting vaccinated, when we talk about screening or vaccination or the need for provider education, you're knowing that that's coming up, you might be able to kind of raise your hand or jump in and say, you know, actually I have this, you know, personal experience, so on and so forth. And so it's really just to know what we're asking for, so you know kind of what those similarities are between that work and the personal experiences you've had. So our asks fall into two main buckets. One is an ask that is, I just feel like will forever exist until we eliminate viral hepatitis, and that is more resources for the CDC. There are numerous reasons for this, and I've started to list those out here. But this is when we go in and talk about hey, we're here because we would like to see additional funding for the Division of Viral Hepatitis and for the work they do around preventing infectious disease among those who use drugs. We support that because it has direct connection to the necessary public health work on the ground for hepatitis B. And that's just sort of like public health 101. Additionally, though, within hepatitis B, we have new screening guidelines that have just come out in the last 6 weeks that very much need some resources behind them to ensure providers know that it's going on. So individuals out and about just living their life can hear a radio ad somewhere or see an ad on the side of a bus that are like, new Hep B screening recommendations are here. Everyone should get screened once. Those sort of public awareness campaigns to help drive folks going and asking and reaching out about getting screened. We have newer vaccine guidelines, less than a year and a half old, that now with the screening guidelines are I want to say like extra robust, in that really we have a whole recommended system of you should be screened. The vast majority of the country should be linked to vaccination, and everyone can be linked to vaccination. We're currently looking at a group within the US of anywhere from half to 2/3 who don't know the fact that they're living with hepatitis B. And so there's just low awareness of their status, and screening would absolutely help increase that. And more screening is really going to require more resources. There's a lot of individuals who don't know what hepatitis B is. They don't know how to differentiate it from hepatitis A. They think it's hepatitis C. They think something else altogether. There's also just those who think they know about it but don't. But believe many of the old myths of it can be transmitted via hugging or touching. So getting resources to combat those sort of mistakes is important. There's also just a lack of surveillance data when it comes to hepatitis B. So folks on the ground who are doing screening and vaccination and linkage to care work aren't always able to have access to the best data to help them make informed decisions about what communities within their jurisdictions are most at need for services. And so if you don't know exactly who in your city or community is suffering, it's hard to make sure they get the care they need. And without investments in surveillance, we're not going to have a complete picture of what hepatitis B looks like. And then kind of another big reason why there needs to be more resources for CDC is that there's just so many touch points to focus on when it comes to hepatitis B. We could spend every dime we have within the system right now just focusing on the African immigrant population, and we still wouldn't necessarily reach everyone. And that doesn't, that leaves out the many other communities where this disease is endemic. Asian Americans, which has been a long time focus for hepatitis B advocates. Native Hawaiian and Pacific Islanders, which require a different sort of cultural competency when approaching. And sometimes the best approaches for those communities go directly against some of the rules and regulations of the CDC and the resources that are available. Those communities have a lot around food, and we're not able to use CDC grant dollars for food. So being able to kind of raise awareness about how to approach these communities that are vulnerable to hepatitis B and find ways to engage them in the right way is one of these reasons we go and have these asks and have these conversations. And of course, with numerous touch points to focus on, also people who use drugs, talking just about any sort of intersection around as individuals enter into substance use treatment disorder treatment, or visiting a harm reduction facility, just making sure that those opportunities aren't being missed, and ensuring that staff there kind of have the information they need to help their community stay safe on hepatitis B. And so that again requires resources to get that information to those places. So that's kind of one of our buckets, and why we're asking for more resources for the CDC specifically around hepatitis B. The second ask, or the kind of the second bucket we're focused on, is trying to ensure that robust hepatitis B services are included in a plan that is currently being promoted in here in DC. So for the last about 9 months, the White House has been working on putting together this very large package that is focused on eliminating hepatitis C in the U.S. It is certainly a great endeavor. The Hep B Foundation is very much in support of this. We are very much yes, but we are yes and. We have long supported a syndemic approach to eliminating viral hepatitis. That has been what we focused on within the National Viral Hepatitis Strategic Plan. It's part of what we've lifted up as part of the National Academies of Science, Engineering, and Medicine's elimination report. And it's honestly how the WHO and many of the other countries that are working towards eliminating hepatitis B eliminating viral hepatitis is working on, like in a very syndemic, focusing on multiple touch points, not just siloing hepatitis C into hepatitis C or B into B. And so we're concerned that the US might potentially be putting together a plan that does just that, which silos hepatitis C away from some core public health interventions for hepatitis B. And so as Congress and the White House kind of work through getting this plan passed, we have some main asks that we would like to see included in this large package. So the goal for the Hep C plan is to have individuals walk into their doctor or harm reduction center, wherever it may be, and go and get a point of care test for their hepatitis C, and then within an hour walk out the door with their treatment started, and so they could be cured 6 or 8 to 12 weeks later. And that is great, except in order to ensure that you are potentially causing damage with your hepatitis C treatment, those who test positive for Hep C have to also be screened for hepatitis B. And so we've been really pushing to ensure that in order for their kind of test and treat model in an hour to work, that there also is point of care testing for hepatitis B. The technology exists, it's been a policy issue, and they're looking to streamline some of those policy issues for the hepatitis C diagnostics. And we believe that it would make sense to streamline those diagnostics for hepatitis B as well, given what their end goal is. Secondly, anyone who is found to have hepatitis B or found to be at risk for hepatitis B, meaning they haven't been vaccinated, we believe that the package should ensure linkage to care and linkage to vaccination. Just getting screened isn't enough. Let's actually complete the cycle. There is a request within the package for private insurers to improve their coverage of hepatitis C medications because they recognize it as being cost saving and everything else. And we believe that there should be a similar encouragement for hepatitis B treatment for similar reasons, just knowing that individuals linked to treatment for their Hep B have much better health outcomes and liver health outcomes. And then lastly, as the individuals working on the hepatitis C plan are reaching out in the community to screen and link to care, these high-risk populations, we ask that hepatitis B be included in that. Reaching individuals where they are, especially within the high-risk communities, is a tough lift. And so if there is success there in linking those individuals to the public health space, we shouldn't just do it on one single siloed infectious disease. We should do it on multiple, especially if they have multiple risk factors, if they share risk factors. So these are our two sets of asks. I got a little bit detailed just because while I doubt every single thing I just said will get said in every meeting, some combination of what I said gets used from meeting to meeting, and it really sort of depends on who's in the room and the knowledge of the staffer. If they're familiar with the plan but not CDC, you might find yourself weighing the conversation one way or the other. Additionally, be thinking through, if you have experience on the ground or personally around, going in for like a high blood pressure test and realizing through a different screening you had some sort of other medical issue, or if you are providing point of care services somewhere, your ability to kind of speak up and say like, yes, in my clinic or in the place that I go to get my care, this is how they operate and handle their infectious disease work, and it really just wouldn't work to have it siloed this way and this way. There are pieces to this conversation that you likely have and are able to contribute that you just don't know yet. So moving on, we're going to just do a quick little role play. I'm going to stop sharing my screen. We have Michaela, Rhea, and I. And Rhea here is going to be a storyteller, and I'm going to be an advocate. And Michaela is our staffer who is just ready to say no to us. She's just, I don't know, maybe she's ready to say yes, but that's a little bit less rare. So we'll just do this a little bit quicker than we normally would, but still get a general sense of how this goes. So. Hello, Michaela. My name's Frank. I'm the director of Hep B United, and I'm here with my colleague Rhea. Rhea, would you like to introduce yourself?
Hi, my name is Rhea Racho. I'm somebody living with hepatitis B, and I also work for an organization in DC that provides screening and awareness events around hepatitis B.
And Michaela, we'd love to hear what it is that you are doing for Senator Cohen.
Well, thanks. It's great to meet you guys today. So actually, I'm new to the health portfolio here, just started about a month ago. So kind of getting my bearings, understanding everything about what's going on in the space. So I'd love it if you guys maybe give me a little bit of overview of what you do and why you're here today.
Yeah, certainly. So normally we would just chat and tell you this, but because I realized that I forgot to share the handout earlier, I'm just going to share my screen right now as part of this role play so everyone can see what sort of information we are working with. Yeah, so, ooh, excuse me, let me get that out of the way. Yeah, so hepatitis B is a infectious disease. It's bloodborne illness that impacts the liver. Most individuals don't have symptoms of their hepatitis B, and therefore it's known as a silent killer. Oftentimes, individuals will live with the disease for years, and it's not until it has progressed to impact their liver into more advanced stage of liver disease or potentially liver cancer that some of those symptoms pop up. Early on, though, some of the symptoms that are found include jaundice, stomach pain, fever, and because some of those, are symptoms you see in other diseases, people will sometimes pass it off as just, getting older or having kind of a tough week and not something more serious and underlying. As such, though, it is very common. Here in the US, there's almost 2.5 million people living with it, and more than 3,000 people die annually. Globally, it is the largest infectious disease in the world, killing more than 500,000 people. And unfortunately, if we of the 2.5 million people living in the U.S., 600,000 are expected to die earlier than they would have because of their hepatitis B diagnosis. I did mention that it is a bloodborne illness. We see that spread through the most common spread globally is from mother to child, although in the US we have a great program to help prevent that. Here we're seeing a lot of increase via use of like sharing needles or other injection equipment for those who use drugs, other direct blood contact, as well as unprotected sex. What's unfortunate though is that we have a highly effective cure that has been around for quite a few years, but just a low rate of vaccination among adults. And so this is something that can be completely eliminated and prevented, but we just don't have the sort of vaccine coverage that we need. Hopefully that covers quite a bit. Anything I missed that you would like to get some more info on?
No, not at the moment. I think that was a really good overview.
Well, great. Well, yeah, that is just an overview, but I'd love to let Rhea take over and kind of just talk about what she's seeing on the ground with her work, as well as some of the personal experiences she's been having, and then we can get into some more of our specific asks.
Yeah, I guess just kind of my quick story is that I was one of those people who was unaware that I had hepatitis B as well until I went to donate blood, and I found out through the testing through that I actually was hepatitis B positive. And after a lot of confusion and follow-up, it turns out that most likely it was mother to child transmission for me. I'm Filipino. In the Philippines, hepatitis B is very prevalent, and so as you saw on that front page, hepatitis B is very common among people of Asian descent, also of African descent. So it is a huge health disparity for Asian American, Pacific Islander, and African communities. And that's one of the things that after I was diagnosed, I became really interested in working with this organization that I'm now involved in that does focus on providing education and awareness so that we can identify people who may not know that they are either at risk or are already potentially living with hepatitis B or could be vaccinated still if they are not infected and have not been vaccinated yet. All of these things are really important because there's so little, I guess, understanding and awareness around hepatitis B. There's also perhaps the misconceptions of how it is spread and who could possibly contract it. And so in order to reach those people, there has to be a lot more targeted outreach and funding and support for the types of resources that are needed to reach these communities and do testing that might not be happening regularly as part of normal healthcare, which is how I lived most of my life without knowing that I had hepatitis B. So that's kind of how I got involved and why I think that this is, what we're asking for is so important, but is very we know it's hard to dedicate an amount of resources to so many different diseases, but we really feel that this has been ignored for a long time and deserves attention.
So can I ask, why is it that it's, been so ignored, and why is testing so low? Is it just not done regularly?
Yeah, so I think part of it is that there are barriers to testing. Only until recently, there were very specific risk-based criteria for screening and vaccination, but in the last couple of years, we've seen a change in the recommendation to where, because we knew there were gaps in all of that and there were barriers to actually testing and vaccinating people through a lot of advocacy and a lot of, I guess, pushing for this. Now we do have recommendations from the federal agencies like CDC and ACIP saying that all adults should be vaccinated for hepatitis B and that they should be tested. So hopefully that will go a long way. But before that, it just, because many communities that were at higher risk are harder to reach populations or have cultural or language barriers, or even among providers, there was low awareness. It just has been, it just was slipping through the cracks, I think.
Well, thank you for sharing this story. I appreciate it.
that slipping through the cracks is part of the reason why there is new screening guidelines from the CDC that came out earlier this year to ensure that everyone receives a hepatitis B screening at least once in their life, and that those at risk for the disease receive it more often. Unfortunately, though, part of the resources that we're asking, part of the reason why we've seen gaps has been the old screening recommendations, but now that those are updated, we need to make sure that that information and knowledge is out so providers can start screening more, patients can start asking more. Additionally, COVID has disrupted much of the services being provided on the ground, and so we are certainly still playing catch up with that. And as we have seen increase in overdose death and other consequences of injection drug use. So has the amount of hepatitis B that is related to that. So really just need increased resources in the public health arena for screening, for vaccination, and for ensuring some of the most vulnerable communities are protected from outbreaks. We will submit our official numbers in our handout that we'll send at the end. But we did want to take one more moment to talk about a piece of legislation that will be coming soon. So the White House or the president announced in his budget that he would like to put money towards a hepatitis C elimination plan nationally, and we are certainly thrilled to see a infectious disease elimination plan from the administration. But we do believe that it is, as currently being described, has missed opportunities to ensure that hepatitis B is also addressed, especially given that many of the experts say that you have to address these issues concurrently, not in a silo. And that many of the individuals being targeted by the hepatitis C plan would benefit from the hepatitis B services. We can send more specifics about that plan, but our main items are really just including hepatitis B in specific areas. And so as they are accelerating point of care tests for hepatitis C, we ask that they do the same for hepatitis B. As they do screening and screen for hepatitis B, anyone they find at risk, they link to vaccination, or anyone they find living with the disease, they link to care. We just don't want someone to be screened as part of the Hep C plan and then just kind of be left with what their screening said and not given the way to be empowered to take their next step. They're planning to encourage private insurers to allow greater access to hepatitis C, and we believe they can easily encourage that for hepatitis B as well. And lastly, just as they're focusing on these at-risk populations, just any sort of screening focus should also include B. So we're not looking for something new or different. We're looking for yes and. So that's what we have, though. Happy to answer any questions you might have or your boss. And as always, we're happy to be a resource for anything that you might be working on with hepatitis B.
Well, thanks, guys, for meeting me today. I do think this is something that Rep Cohen is definitely very much interested in. But I do have another meeting to run to, so just make sure you fill out that form, and we'll be in touch. Thanks.
Great. Thank you so much.
Thanks for your time.